It was my great pleasure to give a keynote address at ADPD this year on the Alzheimer's disease pipeline. And what we see is that there's roughly 120 agents in the pipeline. There's about 30 agents at phase 3 and about 60 or 70 agents at phase 2. So phase 2 is well populated. Of course, many of those agents are not ready to progress or fail in clinical trials, and they're not advanced to phase 3. The phase 1 pipeline is smaller, but my data comes from clinicaltrials.gov, and not all phase 1 trials are registered on clinicaltrials.gov. So it may underrepresent the universe of phase 1 trials. What we can see in the pipeline is that there's a great emphasis on disease-modifying therapies. Roughly 85% of the agents are focusing on disease modification. There are few drugs trying to produce cognitive enhancement. There are a few drugs focusing on neuropsychiatric symptoms, and they're making definite progress. We also see a great diversification in the pipeline. There has been a focus, of course, on A-beta over the previous years. Now we see that tau is coming into the pipeline as a target, that inflammation is one of the most robust areas in the pipeline, and that synaptic protection is also succeeding as a target in the pipeline. So we see that diversification, which I think is going to be very important in terms of advancing new therapies, and very likely in terms of advancing combination therapies that could be used together. Now, there are still a lot of A-beta drugs in the pipeline, particularly the phase 3 monoclonal drugs. And there was a symposium. I was also involved in it. It was sponsored by Biogen and Eisai, looking at A-beta in terms of its basic science. And John Hardy presented on the genetics, and the genetics of A-beta have just gotten stronger and stronger. Of course, we've known about the autosomal dominant Alzheimer's disease, and those mutations routinely involve the A-beta pathways. But there is also an A-beta effect of apolipoprotein E4, which is a powerful risk factor. And we see that genetic variations that steer amyloid processing away from the alpha secretase and towards the beta and gamma secretase pathway are also risk factors for Alzheimer's disease. So as we've gotten more and more genetic information, it continues to point towards A-beta as a therapeutic target and a key player in the Alzheimer's disease processes. Colin Masters was fascinating in this symposium in presenting the idea of production versus clearance and showing how the A-beta is not cleared in the late onset form of the disease. So in early onset Alzheimer's disease, there's overproduction of A-beta. In late onset Alzheimer's disease, there's underclearance of A-beta. And the result is the same. And the basic biology of the Alzheimer's disease is remarkably the same when you look at the A-beta level in these two forms of the disease. Then Philip Shelton's talked about the biomarkers for amyloid. Of course, amyloid PET has become critical in almost all of our clinical trials to define the population that has Alzheimer's disease. Even if the drug itself is not targeting A-beta, we still need to know that they have Alzheimer's disease, and our best tool for that right now is the amyloid PET. The blood biomarkers for A-beta, the 42 to 40 ratio, is really making progress. We see that there's a good correlation between the serum levels and the amyloid PET. But what we do not yet have, and Philip emphasized this, is a cut point for the serum A-beta. So we're not yet able to use this measure as a recruitment tool or a defining tool for clinical trials, because we don't quite have the definition of what is normal and what is abnormal. We do see that there's a strong relationship, so it's likely that we'll be able to come to that point soon. So overall, we see that amyloid clinical trials are particularly mature. There's great biomarkers. We have a diversity of compounds. We have monoclonals with different epitopes that are targeted, and we have successful trials in several of these in early trials. So donanemab, aducanumab, BAN2401, and gantenerumab are all making substantial progress in amyloid reduction and showing preliminary clinical benefit. So I came away from the examination of the clinical trials pipeline for Alzheimer's disease with a lot of enthusiasm for what's happening.